Let's Chat with Denisha presents the series Don't Suffer in Silence Women's Reproductive Health with gynecologist Dr. Kelly. Come on and join the conversation where we speak about the different topics concerning women's reproductive health. Have any questions you want to be answered? Subscribe and be the first to get notification on when these videos are released.
Welcome to another session of Let's Chat with Denisha. Here we have gynecologist Dr. Kelly, and we are going to go straight into it. Don't suffer in silence, endometriosis. So, doctor, tell us, what is endometriosis?
All right. Good night. Thanks for having me, Denisha. Endometriosis is essentially that part of the body that sheds blood on a monthly basis. In our females, we call it endometrial lining.
Mm-hmm.
Essentially, in a normal person, it should only be in that area. However, in persons with endometriosis, that tissue is found in other places of the body, mainly in the pelvis or the lower belly bottom, as some person would refer to it as.
Mm-hmm.
And this causes a lot of symptoms. So endometriosis is basically having those tissue in other places of the body where it's not supposed to be.
Okay, and would we call this like extra tissue or?
Not extra tissue, but I mean, so there's a lot of theory on how it came about.
Mm-hmm.
However, what they know for sure is that these are cells that has migrated from the lining to other places and basically
Okay.
lodge there and actually goes through monthly
Mm-hmm.
changes, and so it grows and grows and break down and bleeds as well.
Okay, so what are the symptoms? And I guess that bleeding then is one of the symptoms.
Right. So heavy
Okay.
bleeding is one of the symptoms, but one most common symptom is actually painful periods and severe pain. So pain and particularly pain that impedes the individual from doing their regular activity. So going to school, going to work, taking care of yourself essentially.
Mm-hmm.
So yeah, so pain. You have some persons will also have like a severe headache and bloating,
Mm-hmm.
abdominal pain, as you mentioned, and heavy bleeding, of course. Those
Okay,
are
so
some of the more common symptoms.
how then is it diagnosed? Is there a test that is run? How do you do your checks and balances to come to a diagnosis?
So usually diagnosis usually made for most persons by their symptoms and what the doctor find when the doctor examines the patient. Um, because of course the only way to make a definitive diagnosis is actually doing a surgery, which mainly involves doing a laparoscopic surgery,
Mm-hmm.
which you're probably familiar with, where they use it, where they put the tiny holes in the
Right.
tummy and
Mm-hmm.
put a camera to see. And they usually take bits and pieces of the tissue that they found in the tummy
Mm-hmm.
that resembles endometrial tissue, and that makes the definitive diagnosis. But as I say, it's a surgery, and of course, all surgeries carries risk, and so
Yeah.
most persons would not have to undergo that surgical procedure to make the diagnosis, and so most persons will be diagnosed based on their symptoms and examination. Um,
Okay. All right. So I'm not sure if you're aware that I don't have my book here. I'm not sure if you're aware that I have written a book called How Not Knowing Cost Me Reproductive Health Issues. And I can remember the first time I've seen my period, it's right there in the book. Like it
right.
was roughly around when I just started high school. And the pains started there. And some of
Right.
the symptoms that you are telling me, I experienced those symptoms. But when the diagnosis was made, it was not endometriosis. Actually, it was a fibroids and also a cyst.
Right.
So I from what I'm getting, it is very important for us to speak to our doctors, go to the doctor to definitely get a diagnosis.
Indeed, because I mean, what the researchers show that 1 in every 10 women
Hmm.
actually have endometriosis, and truth be told, it might be even higher than this because, especially in our culture, a lot of
Yeah.
women think that it's normal to have painful period. And
I
so you
thought
just, yeah,
Dr.
you thought it
Sticker
was
Pin,
normal. Yeah,
I
they think it's
thought it
normal.
was normal. And some of the things that I heard growing up, oh yeah, when you start to have sex, the pain will leave after a while.
Right.
Or
Hmm.
when you start to have kids, the pain will leave.
Right.
But
Right.
it continued and even got worse.
Right. Yes. Yes. So it's a cultural belief that you should have pain, and so sometimes I'll find even patient come in the office and they come for something else, and we
Mm-hmm.
might end up along the menstrual history part, and then when they start talking about pain, and I mean it totally that wasn't that had they weren't concerned about the fact that they were having very painful or even heavy periods,
Yeah.
because in their mind it's normal. And so, a woman need to be educated on that, need to be, get checked out if this is happening. And so you can get an early diagnosis. You
Thank
can
you.
have a person with endometriosis and have fibroids as well,
Yes.
right?
Wow. A double kill that. That is double kill. Oh my God. Oh my God. So then, I had a question, and from what I'm getting is that someone can catch this, but is it hereditary?
Right. So it's not something communicable. So you can't sit by somebody or hug somebody and catch it. But definitely, yeah, it runs in the bloodline. You get your especially first degree relative. So if your mom has it
Mm-hmm.
or your sister has it, there's an increased chance that you can have it as well. So yes, there's a genetic component to endometriosis. So find that it runs in the family, as we'd
Okay.
say.
All right. So let's go to treatment. Like, I'm a woman, I'm feeling these pains. Like, I'm bleeding heavy. It's like I dread my periods. What can I do? What's my first step? And then what are my options?
So many women are struggling with endometriosis and don't even know that they have endometriosis. I hope you learned a lot in this session, but stay tuned for the next video to learn your treatment options and what you can do if you have endometriosis. Go on over to Amazon and purchase my book, How Not Knowing Costs Me Reproductive Health Issues. Just type in Tanisha Jarrett and click on the link above to purchase the book. Share this video with someone. Contact Dr. Kelly at claytonrichardkelly@gmail.com, 876-829-6041. Remember, your health is important.